Welcome to A Closer Look. The Chesapeake Care Clinic provides medical and dental services to the low-income and underserved individuals in our community. Joining me to tell us about those services is Sharon Stahl, Board Vice President of the Chesapeake Care Clinic. Thanks for joining me today.
Thank you, Karen. Thank you for inviting me.
You're welcome. Can you tell me specifically who the clinic serves?
Yes, of course, the underserved, individuals with limited resources, but also we do reach, I know this is a little technical, but a 300% FPL. So that would be for one individual an annual salary of $54,500 roughly in 2022 statistics. So we feel, as the clinic, we chose to lift our FPL requirement from 200 to 300.
And we were talking earlier that it's not necessarily just citizens of Chesapeake that you serve.
Correct. We do serve everyone in the Hampton Roads area of Virginia. Yes.
Okay. What services are provided by the clinic?
Well, this is exciting because let me share my first love, because I am a licensed dental hygienist. And so we have a 5-chair state-of-the-art dental clinic. So dental services, comprehensive cleanings, restorative, extractions if needed. We do partials and dentures and things like that. But our medical side is complete too. We provide medical services along with OBGYN, behavioral health. We do medical medication assistance program, and eye, ear, we have volunteers that are vast that
So you
treat
have a
our
full
patients.
service
Full
clinic,
service,
without a doubt.
yes,
It sounds like it.
Yes.
So how is the clinic funded? Because you mentioned some state-of-the-art equipment. What
Right.
How
did
what
that happen?
allows you to be able to do that?
Right. Well, our executive director is a wonderful grant writer, and she, I think that is our main flow of donations.
Okay.
Thank you, grantees, or grantors, I should say. But it is philanthropic also, and incidental donations that happen with our annual campaign at the end of the year.
And you also do fundraisers or events?
Yes, we're doing one recently. It's called Run for the Health of It.
Okay.
I've signed up. I don't run, but I walk.
And it's okay. That's what I was going to ask. Can you walk as well?
You can walk, you can bicycle. It is just, an app that you can get to and just document the amount of miles you've done in a day.
Okay, so it doesn't necessarily have to be like an event during the day. You're doing this on your own
On
time
your own.
to raise funds.
Yes.
Great.
So I think last year, if I'm not mistaken, we acquired $10,000 from the Run for the Health of It.
That's great.
So we're hoping we can maybe double that.
That sounds great.
Yeah.
So you talk about that event. If somebody wanted to participate in that or any other event, how would they go about doing that?
Yes, I can give you the website.
Okay.
And it's from Charity Footprints, and I've got that information here.
So the clinic also has a website that has information as well.
That's right. You can go right to the website, and it will be right there.
So if somebody wanted to support the clinic or participate in an event, they can definitely do that. I think you brought something as well that tells a little bit about that.
Yes, I have this flyer that we pass around. As a matter of fact, I teach at the School of Dental Hygiene at Old Dominion University.
Okay.
And we have a 33-chair clinic. And so a lot of the patients that have limited resources, no insurance and things like that, and need dental care, I provide this little flyer for them so they can call. They can go through the eligibility that is required for free and charitable clinics. And so this has been spread around a lot. So I will leave this with you.
That's a great pamphlet. So can somebody who has health insurance go to the clinic, or is it specifically for individuals who do not have the health insurance?
Yes,
okay.
Yes.
Which are a lot of people, I would imagine.
Which are a lot of people. We think that, July 1st, 2021, the state of Virginia actually passed an interesting and promotive, health promotive law in that they gave Medicaid adults dental benefits. So that's rare. That is
Right.
rare. So that is 2 cleanings a month, or I mean a year, excuse me, and just an amazing benefit. So yes, if someone has Medicaid and they have insurance, we don't see Medicaid patients. Now, let me mention our a dear colleague, Western Tidewater Free Clinic in Suffolk. They're a hybrid clinic, so they do take Medicaid and they are a free clinic at the same time. So our board is still in discussion about where we should go with that. So that's one of our board challenges.
And so, dental health is it's so important because it can lead to other things if you don't take care.
Yes, diabetes. It aggravates diabetes if there's no dental care. The oral systemic link that occurs with dental. As a matter of fact, there's a research out that if someone experiences having a stroke, they've noticed that in the artillery, the blood flow, is that there is 60% of the bacteria in a stroke patient from oral bacteria.
Right, it's so important.
Yeah, it's very important. So I think when you have a healthy mouth, you're generally more healthy.
Exactly. So it's great that you do preventive care, and you mentioned like
yes.
gynecologist would be there, as well as dental and other
Eyes.
just general
Yes.
eyes, things that a lot of us who are fortunate to have
Yes.
health care take for
Yes.
granted. So that is
Absolutely.
wonderful. That
It's. I love talking about Chesapeake Care. In my philosophy, it's in a very rich country, a very wealthy country. It's too bad we have to have something like Chesapeake Care. But I think every country struggles with those citizens that are part of their country that have limited resources, and what do we do? And Chesapeake Care, being a nonprofit safety net provider, is essential for lifting those who have health disparities.
I agree.
Yeah.
Now, how many would you say, not to put you on the spot for a number, approximately that the clinic serves in a month,
Yes.
in a year?
In a month, yeah. Let me just, if I could just get to my cheat sheet here. We provided healthcare services to 978 unduplicated patients. So, it's not that they came back, but each one is an individual.
And in what time frame was that?
And that was in FY21.
Okay.
Fiscal year 21.
That's amazing.
And that was during, the height of the pandemic, which really did impact every single healthcare facility.
That's what I was going to ask you. How has sort of, hopefully, knock on wood, we're out of the worst of the pandemic. How has things changed? Have they changed for the clinic?
Right. Well, we first incorporated remote patient monitoring, which was telehealth. We were able, through a grant, to receive some blood pressure cuffs that people could have at home. So we could monitor their blood pressure, be on a telehealth visit, have them put their blood pressure cuff on, and provide any strategies to decrease that blood pressure through diet, education, things like this, health promotion. But also we provided remote patient medication pickup. And also we did a mailing of medication that certainly wouldn't have been, medication that was, would not spoil, that needed refrigeration. We'd have to have them come and pick up. So we helped with transportation, we helped with telehealth visits. So we really did an impactful, I feel, taking care of our patients during a global pandemic.
It sounds like it.
Yeah.
So where can someone find out more information? Through the website? And I believe you also have a Facebook page. You may.
Yes.
Okay.
We do.
And all the information is available, of course, on the website, and we'll make sure that gets up.
Yes. And we'd love to recruit more volunteers that, maybe they're retired, and maybe they are healthcare providers or administrative. We have non-healthcare providers that are good at, organizing, filing, things like that. All valuable. Every person, every volunteer, every staff member is so important to the mission and vision of Chesapeake Care.
And it's a great mission.
Thank
for
you.
sure.
Thank
you
you.
for
We
joining me,
thanks.
Sharon. I appreciate it. Well, that does it for this edition of A Closer Look. Thanks so much for joining us, and we hope to see you next time.